Hypnotherapy is often seen as a valuable tool for creating behavioral and psychological change, but it is not suitable for every situation. While it can be highly effective for issues like smoking cessation, phobias, and certain habit changes, even in a single session, it is important to understand that not all concerns can be resolved that quickly. Some issues, such as deep-seated anxiety, self-esteem struggles, or complex behavioral patterns, may require multiple sessions and ongoing reinforcement to achieve lasting results. Hypnotherapy is not a passive cure, but a process that works best when the individual is engaged and committed to change. A significant factor in hypnotherapy's success is mindset. While healthy skepticism is normal, someone who enters a session with complete resistance, convinced that hypnosis will not work for them, is unlikely to experience results. Hypnotherapy is not something that happens to a person. It is a guided process that requires a level of openness and willingness to participate. If there is too much mental resistance, the subconscious mind is less receptive, making the process ineffective. Beyond personal factors, there are clear cases where hypnotherapy should not be used. When dealing with serious medical conditions such as cancer, heart disease, epilepsy, or severe chronic illnesses, hypnosis should never be considered a replacement for medical treatment. While it may provide support in managing pain, anxiety, or sleep disturbances, it should always be used as a complementary approach alongside proper medical care, never as an alternative. Relying on hypnosis instead of seeking medical intervention for these conditions can be dangerous. Severe mental health disorders present another situation where hypnosis is not suitable. Conditions such as schizophrenia, psychosis, manic episodes of bipolar disorder, and severe dissociative disorders require professional psychiatric care, and hypnotherapy is not an appropriate intervention. These disorders often involve complex neurological and psychological factors that hypnosis cannot address and, in some cases, could worsen. Someone experiencing delusions, hallucinations, or an unstable perception of reality may become more disoriented through hypnosis, rather than benefiting from it. In such cases, structured medical treatment, including psychiatric evaluation and appropriate therapy, is the safest course of action. Ethical considerations also play a role. Hypnotherapy should never be used without informed consent. If an individual is pressured into trying hypnosis against their will, whether by a family member, friend, or therapist, the process is unlikely to be effective. Hypnosis requires active participation, and without a person's willingness to engage, the results will be limited. The best outcomes occur when someone chooses hypnotherapy as part of their own self-improvement journey, rather than feeling forced into it. Understanding these limitations is essential for using hypnotherapy responsibly. While it can be a powerful tool for transformation, it is not a universal solution for every problem, nor should it replace essential medical or psychiatric care. When used correctly, it can create meaningful change. But knowing when it is not the right approach is just as important as recognizing when it can be beneficial. What are your thoughts on hypnotherapy's role in behavioral change? Do you see it as a potential tool for personal growth? Or do you have concerns about where it fits within professional treatment options?